transitional beds to help people have an option of where to go. We've also added respite beds, but we have a strategy in the long-term care homes to help improve quality of care in the homes. There's an excellent initiative, which is a provincial initiative called Residents First, and we're participating in that. So in the next few slides, I just wanted to give you some highlights. This is by no means an exhaustive list. It would have been too much for me to present tonight. You have this, but I'll hit the high notes of some of the investments that we've made in these 5 counties that align with the senior strategy. So you have a listing of a whole bunch of things. I'm not going to go through all of them. You need to know that the CCAC provides about $26 million in this region for care of the seniors in their homes. We added, as I said, some enhanced home care services, about $2.4 million. Those 60 spaces that I mentioned for assisted living services cost about $1.1 million a year. This is ongoing funding, by the way. The 8 beds at St. Joe's cost us $660,000. We have a program that's called Going Home that gives seniors someone in their house 24 hours a day for up to 10 days to help them when they first come out of hospital. And it goes on. And you can see some supportive housing in Rockland, for example, and in Cornwall. Health and wellness clinics. On the next slide. Those GEM nurses, or geriatric emergency nurses that I mentioned. We have the nurse-led outreach. We've got some transportation, crisis support, behavioral support services for people who have challenging behaviors as a result of dementia. Next slide. And just recently, just in November, if you recall, in the provincial budget in March, the government announced a 4% increase to the community for community services. The CHamplain LHIN share of that was $11 million, and we allocated close to $2 million in the Eastern Counties region for things like more home care services through the CCAC, expanding some assisted living program, more going home, and some additional respite services. So those are just recent investments. That doesn't include the services that are already in place. You know, the Community Health Center's budget at Seaway Valley, which is relatively new, is over $2 million. The long-term care homes, and on and on. I didn't list all that. These are some of the more recent and new investments on top of the healthcare services that are already in this region. Okay, so that brings me to talk a little bit about long-term care home capacity. And as Dr. Meliodas mentioned, you are a board that looks at data and that looks at numbers and tries to make decisions based on that. So I wanted you to have the long-term care home stats so you have that fresh in your mind. So this shows you the ratio of long-term care home beds for people that are age 75 years of age and over. Okay, so in Ontario, for every 1,000 people who are 75 years of age and over, there are 86 long-term care home beds. And I just want to re-emphasize, long-term care home beds are those beds that are licensed by the province. It's where you can get up to 3 or more hours of nursing care a day. So they're for people who need that level of care. They're not retirement homes, and they're not these temporary beds. I just mention it because sometimes we get confused in the terminology that's out there. And you know, we used to call them nursing homes. Now they're called long-term care homes, right, or homes for the aged. So in Champlain, which is the 3rd bar down, we have more beds than the rest of Ontario. We have 94 beds for every 1,000 senior. And you can see for Ottawa, for Renfrew, for North Lanark, Leeds, and Grenville. Eastern counties, so the 5 eastern counties together have 108 beds per 1,000. And the city of Cornwall has 137 long-term care home beds for every 1,000 seniors 75 years of age and over. So there you have more. I'm not saying that that's the right number or that's a sufficient number. I can just show you how you compare to other parts of the LHIN, to the LHIN overall, and to the rest of Ontario. And on the next slide, I've broken that down even further for you. So you have the actual number of seniors, the actual number of long-term care home beds, and then that ratio. So if you want to look a little bit near the middle, you have Eastern counties. There are about 1,500 seniors 75 years of age and over in Eastern counties, overall the 5 counties. In SDG, including Cornwall, is about 9,500. In the city of Cornwall alone, it's about 4,500. Prescott and Russell is 5,000. And then you can see the number of long-term care beds. And again, those same ratios that you saw. Okay. On the next slide, I just wanted you to see where Champlain compares to the rest of the province. So you have the 14 LHINs. You have their numbers of seniors that are 75 years of age and over, their total number of long-term care home beds, and their ratios, and then our ranking. So Champlain ranks 5th in the province, 5th out of 14. So we are above the middle in terms of the ratio of long-term care home beds that we have to serve our population. So we're not the worst in the province. We're not the best in the province either, but we're in the top 5. So, okay. And then, so that's just in terms of the capacity. And then I wanted to give you a sense of how many people, or the rates of people waiting for long-term care. So we looked at the waiting list for long-term care home beds, and I know that you've been hearing and reading that wait time is increasing. In fact, in Champlain, it's come down a little bit very recently, and the numbers on the waiting list are coming down. So if you look at the number of seniors waiting per 1,000, again, it's just to give you a ratio. So for every 1,000 senior who's 75 years of age and over in SDG, there would be about 52 people waiting, compared to close to 100 in Ottawa, or even 70 in Renfrew County, for example, which is another community that has a high rate of seniors and an aging demographic as well. And Prescott Russell is doing very well in terms of numbers of long-term care home beds. Part of that may be why the numbers are of the ratio of people waiting. They are parts of Prescott Russell closer to Ottawa, and East Ottawa has quite a larger number of long-term care home beds proportionally. So it may be that some people are accessing those beds and not waiting in Prescott Russell. So that's a possibility. So this is just a map that shows you where all the long-term care home beds in the 5 eastern counties are. And we do have 50 long-term care home beds on the Akwesasne Reserve. And they are licensed long-term care home beds. Next slide. So this may not look like much, but this is an incredibly good news story. If you remember the story that I told you at the beginning about the senior person who has a problem, ends up in hospital and gets stuck waiting to go to a long-term care home bed, that's what this graph was showing. So these were the weekly average number of people who were waiting to be discharged, mainly to a long-term care home at Cornwall Community Hospital since 2008, February 2008. And you can see that as we started implementing some of our strategies, our numbers started to come down. Every week there were about 40 people at Cornwall Community Hospital that had no other place to go. And we started to see some improvements, but then things took a turn for the worse, and we hit an all-time high just before Christmas of last year of actually 51 people, and we stayed there for quite a while. And we were quite concerned, but we persisted with our senior strategy and continued to make the kinds of investments that I told you about, and continued to offer alternatives, and continued to foster a thinking mindset in the healthcare providers that seniors could in fact live at home and could be supported to go back home. And lo and behold, our rates have come right down. In fact, in the summer we were seeing single digits, so 7, 8 people waiting, as opposed to 51 people waiting. And the good news story of that is what they were waiting for was no longer long-term care home. They were waiting for a rehab bed to become available, or they were waiting for the home care services to be put in place. So we've are very much starting to see a change in that cycle and in that story, and our numbers are showing that, and we're seeing that not just in Cornwall but across our region. And that is a very good news story, because I can't imagine what life would be like having to live in a hospital for a year or two, and then, I'm not exaggerating, a year or two in some cases waiting to go to a long-term care home. So on the next slide, just want to talk a little about some of the highlights. And this is